What is disability rights legislation for special needs health care? Imagine a world where everyone can get the health care they need without barriers or unfair treatment. That's what disability rights laws aim to do. They are a set of rules that make sure people with disabilities get fair and equal access to health care services. These laws protect individuals from being treated differently just because they have a disability. They also requiring healthcare providers, clinics, hospitals, and insurance companies to make changes so everyone can receive care comfortably and safely. At the core, these laws define disability broadly. They include physical impairments like mobility issues and mental health conditions that limit major activities like walking, seeing, or communicating. This broad definition helps many people qualify for protections. The laws say that discrimination based on disability is not allowed in any health care setting. Whether you visit a doctor's office, a pharmacy, or a hospital, these rules apply. One of the most important laws is the Americans with Disabilities Act, which was passed to prevent discrimination in public and private healthcare services. It requires healthcare facilities to remove physical barriers, such as steps or narrow doorways, and provide accessible medical equipment like adjustable exam tables or accessible scales. It also makes sure that communication is effective, meaning hospitals must offer sign language interpreters or information in formats that people with hearing or vision impairments can understand. States also have their own laws that add extra protections. For example, California's Unruh Civil Rights Act and Government Code Section 11,135 protect people with disabilities from discrimination in healthcare. These laws requiring healthcare providers to make facilities accessible and provide services that meet the needs of people with disabilities. Disability rights laws also cover practical issues. They requiring ramps and elevators so people with mobility issues can access healthcare buildings. Medical equipment must be adjustable and accessible. Communication aids like sign language interpreters or written materials in Braille must be available. These laws also prohibit denying care because of assumptions about a person's quality of life or disability status. They protect against insurance practices that limit coverage for disabilities. Understanding these laws helps patients and advocates recognize when they are being treated unfairly. It also encourages healthcare providers to adopt inclusive policies and train staff on how to serve everyone properly. These laws are the foundation for creating a healthcare system that is fair, welcoming, and accessible for all, regardless of ability. They make sure that everyone can get the medical care they need without fear of discrimination or exclusion.